Today we'll talk about the instruments used in pain management. How to describe the instrument? First, the identification, description of the instruments, various components or parts, start from either proximal end to distal end or vice versa, or patient end to machine end. Specifications, mechanism of action, for example, spinal cord stimulator or radio frequency ablation, sterilization of the instrument or pre-sterilize with whatever, or if it is reusable, then how to sterilize. What are the various advantages and disadvantages, various indications and contraindications, specific precautions and special notes if any. So all these points not be applicable for all the instruments, but wherever it is applicable you describe into this ways. What are the things you should avoid? Common instruments identification is the must. If you don't know, don't fake, tell ever whatever you know. Mistake doesn't fail you, but the blunder does. Make a mistake, don't make the blunder. So few instruments we'll see the pictures, and whenever possible, if there is anything, we'll see. 2E needle, go with the same way. This is RX good needle. So here the difference is at the tip. Even this is used to put the various structures through the epidural pathway. For example, while putting the REX catheter or to put the spinal cord stimulator, the RX good needle is used. And see the tip. See, this is the tip of the 2E needle. It is the tip of the RX good needle, where we can, in 2E needle, a catheter cannot be withdrawn. There is a chances that the catheter might get sheared, but here you can manipulate the catheter. Long spinal needles, RF needles or the cannulas, where the tip is non-insulated. This is insulated part. Describe everything. Radio frequency probe, or this is also called as a thermocouple. Describe the mechanism of the thermocouple. Cool radio frequency ablation kit. This is an RF generator machine. This is cool RFA kit. These are various cannulas, needles, and the pump. Mechanism, you must be knowing the mechanism of the RF, where water is used to control the temperature, and that is why the lesion size is big. Compare the RF needle with the cool RF cannula. Lesion, this is the first lesion you can see is an conventional RF lesion, where it is along the shaft, wherein, and that's why it is called as angle dependent, where the nerve should be parallel. The second is cool radio frequency lesion, where it is also called as angle index. These are the various factors which decides the temperature of the lesion size of the RFA, where the diameter, tip length, the construction, the temperature, the time to a certain degree increases the lesion size. You can see the lesion size. This is cool RFA lesion. This is a conventional RFA lesion, where the lesion is along the shaft. One thing I want you to tell is, see, this is the difference between the conventional and pulse radio frequency. In pulse radio frequency ablation, the lesion is behind the tip, so the tip should be perpendicular, while in conventional the lesion is along the shaft, so the needle tip should be parallel to the nerve. So in pulse lesion, the tip should be at the perpendicular. In conventional, it is at the parallel to the nerve, and in cool radio frequency, it is angle independent. Various differences between the continuous or conventional radio frequency and pulse radio frequency, where what is important is tissue temperature in conventional is up to 80 degree, here it is up to 42 degree. The mechanism is conventional is thermal, in pulse it is neurobiological or electromagnetic. Conventional deafferentation syndrome, chances are there, where pulse RFA, no side effect for the pulse deafferentation like that. Conventional, the duration is more than the pulse RFA, and we cannot do the continuous conventional RFA into the peripheral nerves, but pulse RFA can be done for the peripheral mononeurone. Another thing is a Rax catheter. Rax catheter is procedure for the epidural adhesiolysis. You might be given the Rax catheter. Rax kit will look like where there will be a catheter, syringes, needles, manipulator, and you can see that there is a uniform infusion, a small distal tip, a safety ribbon is there, a low friction, and this is how the Rax catheter is look, mainly used for the epidural adhesiolysis. Another is trigeminal balloon decompression kit. So various parts of the kit will be PVC balloon catheter, puncture needles, syringes, connectors, and the, the pressure monitor. We'll be giving a vertebroplasty kit. There will be introducer, cement inserter, guide pin, dilator, drill bit. Of course, the indication is vertebral fracture where the posterior cortex is intact. That is the question we will ask. Hypoplastic kit is nearly the same as the vertebroplasty kit, except for the kyphoplasty balloon will be there, which makes some space, and it is said that it creates some space there, so cement can easily accumulate over there. Intrathecal pumps. Various drugs used for the intrathecal, ziconatamide, baclofen, and morphine are FDA approved drugs. Various parts, the catheter port, reservoir, and this is filling port where we have to fill the drug. Spinal cord stimulator is pulse generator, leads, remote control, and charger base station. Leads, two types of leads. One is laminotomy leads, so where you open the lamina and put the lead surgically. Another is the percutaneous leads. Usually we use the percutaneous lead. Disc pressure monitor. Dear friends, we have the fellowships, 1 year fellowship we run. Please go through all these things and